Hello, I'm Jawad. I'm Executive Medical Director at East Lancs NHS Hospital Trust. This is my update on the 19th of August 2021. I'll start with the numbers of people who have been diagnosed with COVID-19 in the community. So in Blackburn with Darwin, we had 192 per 100,000. In Burnley 257, and same numbers in Hyndburn. In Pendle we had 259 per 100,000. Ribble Valley is 286, and in Rossendale 232 per 100,000. So the combined total for our boroughs is 239 per 100,000. Reassuringly, the numbers are going down, and this is a definitely positive direction that the transmission of virus we have seen so far. So less being transmitted in the community. However, you'll realize that the numbers are still high when compared to what it should be. Again, reassuringly, within Lancs and South Cumbria, we have the lowest transmission rate. This is again all down to a combination of efforts both in public, taking the precautions of wearing masks, social distancing, hand hygiene, respiratory hygiene, but also down to vaccination. As you may be hearing in the national news, we are seeing that virus is being dealt with through antibodies by vaccination. However, one thing which the vaccines are not doing is preventing transmission, and hence comes back the emphasis on that social distancing and all the precautions that one has to take. Thankfully, vaccines is helping in reduced severity of the disease. So please follow all the rules that we have been talking about in the past. What we are also seeing is the reduced number of patients with COVID-19 in hospital. As of today, we had a total of 22 patients in hospital, 2 of which are in intensive care and 19 on general ward. And as a result of reduction in admissions, we have also closed one of the COVID wards. So till last week, we used to have 2 wards where we would look after our COVID patients. But now we have only 1 ward. Again, it's a sign that things are getting better. And so is our efforts on restoration work. As I have mentioned previously, we, as a consequence of COVID-19 infections, have developed a significant backlog, which is being gradually attended to, but it will take some time. So it's a plea that when you get your appointment for any operations or interventions, please do the right thing. If they are being asked to self-isolate and have a PCR, then follow the rules so that we can do the timely interventions that are required for every individual who is on the waiting list. Important again, the same message of vaccination, not only for COVID-19, but also for flu. Now, from September, we will have start of the flu campaign where people will be offered flu vaccination. One thing which I must say is that combination of COVID-19 and flu is going to be quite bad. So you need to protect yourself. So whenever and whoever is asked to come forward for their vaccination for flu, please do so. Unfortunately, A&E still is seeing a lot of pressure, and it's a combination of factors which is accounting for it. Like previously, if you really need to attend, then yes, we will look after you. But if there are things which your GP, your local pharmacist and other support that is in the community can help, then please attend to it first rather than A&E. There are long waits, and we don't want people to have a bad experience at our hospital, but neither we want them to stay behind if they really need to be in hospital. So see your GP. You have 111 which will guide you to attend to hospital if need be. Otherwise, they'll provide you the right information. Our ambulance services, because of this, are also under huge pressure. So please follow whatever your GPs and local surgeries and your pharmacies are offering before you think of ringing up at 999. I'll update you next time in a couple of weeks' time. Till then, look after yourself. Bye for now.